Hello and welcome to the presentation on high-dose vitamin C for use in cancer therapies. This is by Lee Fisher, Whitney Donahue, Ashley Millhiser, and Catherine Schneller.
High-dose vitamin C is considered anything above 15 grams. The max dose would be 150 grams. The therapeutic goal when giving high-dose vitamin C IVs is reaching a peak plasma concentration of around 20 millimoles. There's been several case studies using differing time limits on duration of treatment, anywhere from 2 months at a rate of 2 IVs per week to 1 year, and then continuance every couple months for several years. An example of a dosing schedule done at SCNM by Dr. Heather Paulson is starting at 12.5 grams of vitamin C, and then testing for G6PD, and then after test results are received, increasing from 25 to 40 to 50. So all of these IVs are usually dripped very slowly, around 12 drops per 10 seconds. You're always going to check CBC, CMP, liver function, as well as a UA before doing your IVs. Depending on how the patient tolerates it, you can go from 25 grams straight up to 50. Usually, Dr. Paulson doesn't dose at higher than 50 grams. Some doctors in other studies dose at 75 grams or 100 grams, but it's been shown that above 50 grams, it doesn't increase the serum levels. Unless you have a patient that has a very large body weight or larger circumference, you may dose higher, but with a normal sized patient, 50 grams is enough. So you're looking at, for a 250 ml bag, the IV is probably going to take 1 to 1.5 hours, and a 500 ml bag would take around 2 to 2.5 hours. An IV schedule based on the previous dosing schedule would look something like this. So the patient's going to receive 1 IV per week, starting with IV number 1, and then progressing to IV number 4, depending on patient tolerance. Once IV 4 is reached, they can continue to receive that dose for subsequent weeks. Other protocols to note, the Riordan intravenous vitamin C protocol. His IV infusion begins with 15 grams of vitamin C twice per week and increases to 60 grams twice per week. The IV treatment is continued for 1 year, after which the patient can reduce their infusions to once every 2 weeks. From case studies done of this protocol, it was found that the majority of cancer patients require 50-gram IV infusions 2 to 3 times per week to maintain the therapeutic levels that they like to see. For this protocol, they actually monitor the plasma levels monthly to see that the therapeutic range is achieved. If it's not achieved, they do increase past the 60-gram dose up to 100 grams. So mechanism of action, the vitamin C IV dose gets converted to hydrogen peroxide inside the tumor directly, basically. The concentration at which this occurs is only achieved by IV administration. The IV vitamin C actually produces concentrations that are 70 to 100 times the maximum tolerated dose in an oral form. And in recent pharmacokinetic studies in men and women, it shows that even 10 grams of vitamin C given intravenously is expected to produce plasma concentrations that are 25-fold higher than those concentrations of the exact same oral dose of 10 grams. The hydrogen peroxide has been demonstrated to be the effector species that mediates the vitamin C-induced cell death in cancer cells. Concentrations of the vitamin C does this by formation of an ascorbate radical and the hydrogen peroxide. And there is a little graphic there to show you exactly how that happens. Pharmacologic ascorbic acid, which is the vitamin C concentration, produces extracellular hydrogen peroxide, which diffuses into the cells, depletes ATP in sensitive cells, and thereby causes cell death. It's also shown that it's been selective in the killing of cancer cells and not of normal cells of the body. The vitamin C doses selectively generate the ascorbate radical in the extracellular fluid, but not in the blood, making it toxic to cancer cells and not the normal cells of the body.
High-dose vitamin C treatment is available in the United States, but is only approved to be used as adjunctive treatment in combination with conventional treatment such as chemo and radiation. It is not approved by the FDA, therefore cannot be used to treat cancer or any other medical conditions as stated by the National Cancer Institute. The FDA does not regulate dietary supplements, therefore states that it is not a safe or effective treatment, as not all vitamin C supplements, batches, or brands are the same standardized dose, therefore the efficacy may be misleading for treatment. Studies have shown that multiple types of cancers respond to high-dose vitamin C treatment, as it has been found to decrease cell proliferation in the following cancers: prostate, ovarian, pancreatic, colon, hepatocellular, mesothelioma, and neuroblastoma.
Use of vitamin C with cancer is in category A, safe but efficacious. Mechanism of action has been clarified in many uses, and a plethora of studies have been shown, but methods and dosing of use can vary according to independent variables such as type of cancer, availability, dosing schedule, and practitioner. Because of this, further research is required. Using vitamin C adjunctively should be carefully considered with your oncologist.
So there are several reasons to recommend vitamin C as an alternative therapy. First of all, it's safe. There's not a lot of side effects that are known. It's not known to interfere with or increase the toxicity of a lot of chemotherapeutic agents, so it can be used in conjunction with them. Intravenous vitamin C can improve the quality of life, physical function, and decrease toxicities associated with chemotherapy, including fatigue, nausea, insomnia, constipation, and depression. There's also reported instances of tumor regression using IV vitamin C, and it's associated with long-term remission and survival rates. Some potential reasons not to recommend vitamin C as a therapy for cancer are there was a wide variety in the dosing ranges in various studies, so there isn't a very cohesive level of study about the amounts that are best used. It's also not widely accepted among all medical professionals, so if you're working in conjunction with an allopathic oncologist, that might make the relationship a little bit difficult.
Here's a list of the resources used to complete this project. Thanks for watching.